Thank you, Jen, for that fantastic presentation. Jen and I have the same approach in regards to prospective surveillance model of practice in our respective private practices. So I may repeat some of the information that Jen has already shared, but it's not such a bad thing when reinforcing this message. You have heard all the statistics in the preceding presentations covering the rates of breast cancer related lymphedema and risk stratification relative to the level of cancer treatments and the recommended protocols for monitoring for development of early signs of lymphedema using SOZO bioimpedance technology. So I would like to cover how the SOZO fits in private practice. My name is Kate Perkins. I'm a cancer rehabilitation and lymphedema therapist. I have private practice in Erina on the central coast of New South Wales, which I established in 2017. 90% of my caseload is breast cancer related. So I have a strong focus in the early monitoring for breast cancer related lymphedema. But I also follow the same principles for other cancer diagnoses involving surgery, lymph node removal, chemotherapy, immunotherapy, and radiation. So I initially started using the U400 bioimpedance spectroscopy unit for L-Dex measures when I first started my practice, but very soon upgraded to the SOZO as soon as it became available. I just found the SOZO so efficient and user-friendly. So not only to complete the baseline L-Dex measures and ongoing L-Dex measures, but it's a fantastic tool to measure the outcomes of treatment. But the user interface is also a fantastic visual tool for your patients and for their education, and as well as the reporting aspects to share your information with the rest of the medical team. But to achieve the pre-treatment healthy baseline L-Dex measures, you need your referrals from the medical team. You need to get out there and educate your GPs, the breast surgeons, the medical and radiation oncologists, and breast care nurses, and link in with the public system. They need to know you exist for a start, and they need to know why they are referring for pre-treatment baseline L-Dex readings. I have some wonderful GPs and breast surgeons who do refer their patients for their pre-treatment L-Dex readings at diagnosis, for their healthy baseline L-Dex measures, and for ongoing breast cancer rehabilitation. But I'm still continuing to educate some surgeons who feel that those patients who are scheduled for a lumpectomy and a sentinel node biopsy, they feel that those patients are low risk of developing lymphedema symptoms, so they don't send them for the pre-treatment baseline L-Dex readings. So it's this patient population that I consistently see, unfortunately, after their second surgery, following axillary node clearance, have already commenced their chemotherapy or radiation therapy and come to me referred by their GP because they're already showing signs and symptoms of breast cancer related lymphedema. So I don't have a pre-treatment L-Dex established, so we've got nothing to compare it to ongoing throughout their treatment. So then the L-Dex reading becomes that tool to measure the outcomes of treatment. So it's also important to continue that message and continue that education as to why the medical team need to refer their patients at diagnosis. So to get that baseline L-Dex reading, so we've got something to compare to. But they also need to know the other services that you provide that will help reduce that risk to their patients of developing breast cancer related lymphedema. So that includes your mobility rehab, scar tissue management for surgical scar tissue and radiation scar tissue, treatment for cording, prescription of graduated exercise programs, prehabilitation and rehabilitation, prescription of compression garments, whether they're for preventative purposes or maintenance reduction purposes, and ongoing daily wear, or related interventions where necessary, or manual lymph drainage massage, and patient education, so their patients can self-manage throughout the lifetime of their treatment and into the fitness, recovery and fitness phase. So from a patient's perspective, I find that the pre-treatment L-Dex measurement is the opportunity to drip feed education, especially those who I work with pre-neoadjuvant chemo phase. I guide them through an exercise prehab program, and then I'm with them post-surgery and through their radiation treatment and through their recovery phase and going into their fitness phase. So in my experience, it's these patients who have been referred for their pre-treatment L-Dex measurements are far more prepared for what to expect during and after treatment, and they're far more proactive in their rehabilitation and their desire to reduce the risk of developing breast cancer-related lymphedema. So I have a couple of case studies here. So this particular lady, 64-year-old lady, was referred to me pre-neoadjuvant chemo for her baseline L-Dex measurement. She couldn't complete her entire course of neoadjuvant chemo because she experienced numerous bouts of diverticulitis. So we have a baseline measurement, which you can see is 1.9. That's pre-neoadjuvant chemo. And then we took another reading pre-surgery. You can see there was a number of spikes and troughs throughout the course of this treatment, and that coincided with the adverse effects of chemotherapy. So she developed or experienced quite severe peripheral neuropathy, where she was getting rashes and swelling in her hands. She also experienced multiple bouts of diverticulitis again. So the L-Dex measure here became a tool to measure the outcomes of intervention. So which included prescription of custom-made garments, which included sleeve and gloves, in combination with a nighttime compression glove and sleeve used in conjunction with a compression pump to help reduce those symptoms. And so this worked beautifully. So we also did scar tissue management to help mobilize that scar tissue around the mastectomy scars, and also post-radiation to increase that lymphatic flow through the tissue. And so throughout the treatment, she participated in her prescribed exercise program, as well as post-treatment participated in the Pink and Steel Next Steps group program. So as you can see, the latest measurement that we took on the 12th of May is 5.5. So that's well and truly back into the normal range. And so we've able to reverse those lymphedema symptoms. And so she's managing with her compression pump that she uses intermittently, and not finding the need to have to wear her daily compression garment. So I think that's a little bit of a success story there. So this next slide, so using the L-Dex measure as a tool to support your clinical observations. So this 46-year-old lady was referred to me by her GP after her second surgery. So her first surgery involved a lumpectomy and sentinel node biopsy on her right-hand side. She came to me 2 weeks post-surgery. So that initial, so she didn't get a baseline L-Dex reading. So there's nothing to compare it to. So that score of 25 at that point, 2 weeks post second surgery, was indicative of some post-operative swelling. She had limited range of movement, which was obvious, and she also complained of cording symptoms, which I was able to treat. The second L-Dex measurement, which was not long after her, which was coming down naturally. So she was, that post-operative swelling had reduced significantly. Her shoulder mobilization had increased within the protocols of 3 weeks post-surgery, and nil reporting of pain symptoms. So her third L-Dex measure, it started to nosedive in the opposite direction into minus 28.8, which was indicative of something going on the opposite side. But it also coincided with the insertion of a portacat and her first round of chemotherapy. So there was no signs of swelling on the left-hand side. Her right side was looking fantastic. She had great range of movement, no swelling. And so I wanted to monitor her quite closely. So I got her back in. She wasn't due to see anyone for 2 weeks after that reading of minus 28.8. So I got her back in just to monitor her. And that's when the score was just going rapidly down in the opposite direction. So that was 72.3 units from the baseline in the opposite direction. Clinical observations, her left arm was swelling. She had swelling in her left hand, visible pooling in the supraclavicular area. She complained of shortness of breath on exertion, so walking upstairs or having a shower or getting dressed. She actually didn't want to come in when we did call her to come in for a review. So I contacted her oncologist immediately. I was able to tell her what her L-Dex score was and what I was seeing and what the patient was reporting. And so I was querying potential DVTs. So she was sent off for scans immediately, and those scans demonstrated she had multiple DVTs in her left arm and 3 small clots in her lungs. So she was administered, she had hospital admission straight away, and she's now in recovery. So in this instance, L-Dex is a fantastic tool to support your clinical observations and be able to share that information with the rest of the medical team. So in summary, the SOZO is, in private practice, is a fantastic tool to have in your toolbox. It helps guide your clinical decision making. It's a great tool to measure the outcomes for treatment. It provides a quantitative element of reporting in supporting your clinical observations. And the L-Dex and the body composition tissue analysis readings offers the patient something tangible, so they are proactive in their rehabilitation. And so I'd like to thank ImpediMed for allowing me to share this experience, and I look forward to your questions. So thanks very much for having me.